Now, lupus is a long-term autoimmune disease which can affect any part of the body. And this morning we're marking Lupus Awareness Month with Kate Fitzmaurice, who was diagnosed with the disease 2 years ago and has helped to establish Ireland's first lupus support network, Lupus Group Ireland.
We're also joined this morning by consultant rheumatologist Dr. Suzanne Donnelly, who's one of the top researchers of the condition in Ireland. Good morning to you both.
Good morning.
Thank you for joining us. Suzanne, can I come to you first? Before you explain what lupus is, maybe you'll tell us what exactly an autoimmune disease is.
Okay, well, an autoimmune disease is basically a disease where your immune system, which is there really to fight infection and to do good things for you, suddenly turns upon itself and starts doing bad things. So the focus of the immune system really is to fight off invaders. So what it does is it mounts a response that is really designed to clear things like bacteria and viruses. That causes inflammation and damages the target. The problem with autoimmune diseases is that the target is actually part of your own body. So it may be one of your own cells or one of your own tissues, anything from your skin to your joints, to the lining of your heart, to the lining of your lungs, even to your kidneys or your brain. So the issue is that your immune system for some reason has become hyperactive or dysregulated and starts doing bad things.
Okay, and lupus is one of the conditions, I suppose, as a result of that. So maybe you'll tell us exactly what lupus consists of.
Well, lupus, as I say, happens when the immune system gets dysregulated. It is a very interesting condition, but it's also a very severe and chronic condition in many cases. The difficulty with lupus is that many autoimmune diseases are targeted against one tissue. So you might have autoimmune disease in your kidney or in your nervous system. The thing about lupus is it can target almost anywhere, and that is one of the big difficulties, both living with lupus and even sometimes trying to diagnose it and coming to treat it, because when you think you've got it sorted out in one place, it can pop up somewhere else.
It also imitates other illnesses, doesn't it?
It does, and that again, you know, you'll find there's a lot of people. I think in America the statistics would suggest that people can have the symptoms for 4 years and see maybe 4 or 5 doctors before they get a diagnosis. And one of the reasons for that really is because it can look like other things, and sometimes even before we as specialists make a diagnosis, sometimes you have to outrule things like severe infection or chronic infection, sometimes even cancers, things like that, before you can be absolutely sure that you're dealing with lupus. So
just before we go to Kate, is there any particular group that's more susceptible to it?
Yeah, I mean, this is predominantly a disease of young women, and I think that's one of the things that surprises people. They don't expect young women to become very ill with these sorts of conditions. The usual onset of age is somewhere between 15 and 44. And obviously, because of that age group, we do think that there's probably something to do with hormones in the female system.
I was going to say that is in relation to female hormones.
It is there are, let's just say there's a lot of research ongoing, Mark, but it's not known, but certainly even individual patients would describe hormonal flares, you know, so that these things can happen. So predominantly young women, but I think it's also important to point out, and I think particularly from our perspective, men can also get it. And one of the big issues when men get it is that they can very often have more severe lupus, and it can be that bit later to be diagnosed because GPs and very often ourselves, rheumatologists, don't necessarily think about it because it's so typically the disease of young women.
And of course men are reluctant or slower to go and
very
get things done. Okay.
Very often.
Now, Fitzy, as you describe yourself on your Facebook page, okay, we've had the science. What's the practicality of living with lupus?
Oh, it's tough. At first you don't know what it is. My mum described it as living with a hypochondriac. There's something wrong every day, and it could be something totally different every day. One day your elbow might be sore, or your leg might be sore, or your feet might not fit into your shoes for a couple of weeks.
How sore?
I suppose it's not the best way to describe it to you, but when your feet are sore, it's nearly like you've been in huge stilettos for weeks and your feet are burning and you can't put them near anything. You have to sit sleeping up because you have to stick your feet out, they're so hot and burning. Sometimes my hand goes into a claw that my muscles spasm up and they can't release, so I couldn't even hold a cup of tea. Then I suppose in June was probably my worst flare. I woke up one night with really bad chest pain, so I went to the doctor obviously, but I was a bit reluctant because it's lupus and it's like, that can go away tomorrow, you know, I'll be fine. But it didn't feel right to me, so my GP, who's brilliant, she sent me for a chest x-ray, and it turned out I actually had fluid around my heart, which obviously is quite severe. So I went to a cardiologist in Kilkenny, who then told me I had to go to hospital. So I was sent to Cork for 2 weeks.
Right.
So
it's only 2 years ago since you were diagnosed, Kate, is that right?
Yeah, exactly, yeah. That's kind of when I stumbled across Lupus Group Ireland. It had only just been set up by Jessica, who, like me, was just diagnosed. And again, with lupus, it's quite hard to find things to help other people in Ireland, so she decided to set up her own Facebook group.
Okay.
And that's where I stumbled across it. And I became quite active, and Jessica asked me to become a member of the committee. So I'm now spokesperson, so hence why I'm here.
What sort of treatment do you have to or medication do you have to take on an ongoing basis? Or is there any treatment?
Yeah, well, there's different treatments depending on how severe it is. At the moment, I take 6 things at night and about...
when you say 6 things, 6 different types of...
6 different tablets,
pills.
Yeah.
Right, okay.
Pills, yeah, exactly. I suppose one of the worst ones for most people with lupus, or anyone who takes them, is steroids. I've been on steroids since I got sick in May last year. So that's quite tough. Being a girl, you put on extra weight, you have a round shape in your face. They make you quite agitated. They make you lose sleep, so you might often have a sleepless night, and then you'd have to go to work the next day and, you know, do your job as you're meant to. And then again with steroids, even though it's part of lupus, you have severe fatigue as well. So you're kind of trying to combat everything at the same time.
There's a checklist of symptoms that are quite extraordinary. Joint pain, chronic fatigue, skin rashes, low-grade fever, headaches, Raynaud's phenomenon, hair loss, dry eyes, weight loss, weight gain, chest pain, nausea, anemia, flu-like symptoms, migraine, oral nasal ulcers, depression, miscarriage, reaction to sunlight, kidney disorders, pleurisy, heart or lung damage, diagnosis. That's any or all of above.
Yeah, well, I have a good majority of them. Yeah.
And you're still sitting here smiling, Kate.
I suppose, well, the depression doesn't really affect me. I have a really good support group, being my friends, my family, my boyfriend, and then you have Lupus Group Ireland. When I was in hospital, there wasn't a day that went by that there wasn't a tweet or a Facebook or even a text from someone from the group. And my family have been really, really good.
Yeah, that support is just so important, isn't it?
So good.
Okay,
yeah.
Lupus Awareness Month, the point you want to get across is that A, it's there. I actually stupidly thought that this only happened to Americans, because I only ever saw it in American medical programs. I didn't think, well, maybe it's
like
something to do with some ethnic
like
group over there. Exactly. I didn't think that we had it in Ireland, which just goes to show you how naive and idiotic we can be. Okay, listen, thank you very much for that. Is there a one-stop shop people can go to?
No, we have loads of different options. There's mobile, there's email, we have Facebook, and we have Twitter as well.
Okay.
Brilliant,
So
okay.
any
The
of them.
support group was on the screen a moment ago, and we'll put all the details on our own Facebook page as well.
Can I just
Kate.
say, Jessica, who did set up the group, was meant to be here, but lupus is quite unpredictable.
She's having a bad day.
She's having a bad day.
Okay.
Yeah, so we
Sorry to
just
hear
want to wish her well.
Okay, thank you both very much.
Thank you very much for having us.
Now,